Hello, my name is Stuart Elborn. I'm Professor of Medicine at Queen's University Belfast and a respiratory physician. I'm going to talk over the next 20 minutes or so about COVID-19. There's a lot out there already. There are over 2 billion posts on the internet now on COVID-19, and that reflects that we're in a really difficult, challenging situation with a pandemic crossing the whole world, and almost every nation now actively involved in trying to manage this viral infection and to protect particularly the older and the vulnerable from the severe form of COVID-19 disease, which results in a syndrome called adult respiratory distress syndrome and is associated with a high mortality. We know a bit about this virus. It's relatively recently emerged as a human pathogen. The origin of it is unclear, but the virus itself is very similar to a similar coronavirus found in bats. And it may be that the smuggling of unusual animals has been part of the process in which this virus has found its way from animals into humans. The virus is very rapidly transmitted. It's more infectious than influenza, and on average, one person who is infected with the coronavirus CoV-2 will transmit that virus to 2 to 3 other people. That means the virus multiplies by being transmitted to other people, and so the numbers in a society where the virus occurs grows exponentially. And you'll have seen this on news reports and on internet and print reports showing that this virus spreads rapidly within societies. We're in the UK and in Northern Ireland at the beginning of what has been called a surge. That's where we're at the bottom of the curve, and it's predicted that over the next few weeks, the numbers will increase in this exponential way by more than doubling on each round, so that we may have a large number of individuals who are infected. That's the basis for the current government guidance in terms of socially distancing and isolating to reduce the likelihood or the risk of spread of the virus to other individuals. And the reason for doing that is primarily to protect the healthcare system, because if a lot of people get sick all at once, our healthcare infrastructure and the fantastic people who run the NHS may not be able to cope with the numbers. So that makes it absolutely critical that we all abide by the guidance that the government has given about staying at home, not having interactions unless under the circumstances they've outlined, and to reduce the spread of this virus for the good of our society. These actions will also protect individuals from acquiring the virus in a personal way. But the real reason for doing this is to protect society, to protect older people who are more vulnerable to this viral infection, particularly those who have cardiovascular or respiratory disease and diabetes, but also individuals who have multiple diseases which occurs more frequently in the older age groups. It's also important for us to recognize that although the impact on younger people is of a more mild infection, younger people still have a mortality. And that makes it important for all of society to engage in the guidance that's been given and ensure that we reduce the impact as much as possible. The virus is called SARS-CoV-2, and it causes a condition called COVID-19. COVID-19 is a range of symptoms, mostly with fever, high temperature, cough, and some shortness of breath. There may be upper respiratory symptoms and a general feeling of aches and pains similar to those you would have with influenza. In some people, there's been some gut symptoms as well. In young people where it may be more self-limiting, the disease lasts for something around 5 to 7 days, and there is full recovery. As I've said, for those who are unfortunate to have an underlying disease, the outcomes are less good, though there still can be full recovery in those who have underlying conditions. However, it is really important that we protect individuals in this situation. There's been a lot of discussion around testing for coronavirus, and there are tests available which diagnose the virus using what are called molecular tests, and these are being used widely across a number of countries. The UK and Ireland are cranking up their testing facilities over the next weeks so that we can have better measurements of acute viral infection. There is another test which is coming along called a serology test, and this measures the antibodies in a blood sample, which tells us when people have had an infection with coronavirus CoV-2, their antibodies will increase, and these can be measured, and then this tells us that an individual has had COVID-19 and has recovered. This testing is very important and is being prioritized in most countries as we speak. The epidemiology of COVID-19 and what's going to happen over the next weeks and months is uncertain. I think we can take some encouragement from the experience in China and Korea, where having so-called lockdown and avoiding contact between individuals has significantly reduced the number of positive cases. And in both of those countries, there is now some optimism that they're through the worst of the first peak. What is uncertain is whether there will be further outbreaks of infection when you loosen the social distancing and isolation policies. This can be managed if we have good testing, in that we can detect these early, do contact tracing, and then isolate those individuals who might be infected in a second wave. We will learn from China, China, South Korea, and Singapore, where this is now being actively managed, to understand how we might do this in Western countries and indeed other countries around the world when we get to a point where the surge is controlled and we're then moving into managing a re-establishment of business as usual. These processes will take some time, and it's unlikely that we will be through this in the next few weeks. I think this is going to take months and may have impacts into next year. The impact already of this pandemic in terms of our behaviour and how we manage society have been really immense. travel internationally has almost shut down now, and even travel within countries is being managed very carefully to reduce any potential for cross infection, and to continue this very rigorous clampdown on individual interaction to stop viral spread. Uh, Many of our jobs have been affected. People are working at home. Some jobs cannot be delivered because they're non-essential, and we're now in a period of time where only essential activities will be supported in many of the countries across the world, including UK and Ireland. I would emphasize again how important it is to follow these guidelines, because this is the most important way that we can help control the spread and mitigate the effect on our health and social care system. In these situations, there is understandably a lot of anxiety and fear around this virus and the consequences of it. I would emphasize again, though, that the majority of people who do acquire the virus have a medium-term illness from which they will recover. And the important group to protect is our elders and those who are vulnerable because of having multimorbidity diseases. But we will come through this. There have been many epidemics of infectious diseases over centuries in the world. We've, in the last century, had the so-called Spanish flu. We've had other flu viruses. We've had epidemics of smallpox and plague in the past. And human societies have been able to find ways to get through those epidemics and to move on. And we will do that, I think, with this current epidemic, because we have fantastic scientists working on new treatments and vaccines. We have public health systems that are managing the current process. And if we work together as a society and really bring all of our innovation resources, our organizational resources together, we can manage our way through this and I think come out as a stronger society. There will be a rebuilding that will be required as we come through the other end of this pandemic. And again, that will require society, I'm sure, working in different ways than we have in the past, but certainly working together in a collaborative and cooperative way for the good of all. This will be new ways of doing things, new ways of working, new ways of thinking about our leisure and our travel, new ways of thinking about the security of our food chain to provide the nourishment that we need, and that will, I think, change how societies prioritize, how they think and look after those who are vulnerable within society, and will provide, I hope, an optimistic platform for us to move into the next year and into the rest of this decade. These are really challenging and in many ways frightening times, but there is light at the end of this tunnel. We will get through this. The NHS and the fantastic people working in our health and social care system in Northern Ireland have been working tirelessly over the last weeks and months to prepare for this, and have done all that can be done to make sure that we are prepared as a community to deal with the illnesses that will be generated and the issues that will come up from the very heavy pressures that will be on the National Health Service generally and in our health and social care system in Northern Ireland. It's up to all of us to really come together and take responsibility to make sure we follow the guidance from public health agency, public health groups in the UK and Ireland, to make sure that we are playing our part in mitigating the impact of this infection. It's important for us to work together to support the elders and vulnerable in our society, and then to be thinking about how we work together for the future to rebuild our society, to support our health service, and proceed with confidence then into a new future. Thank you very much for your attention. Good evening.